So, have you experienced seeing two of everything since your stroke? Maybe your reading has become more difficult, or maybe just moving around the house just feels off. I want you to know that that if you've been experiencing double vision since your stroke, you're not alone because double vision can be very common after stroke, depending on the type of stroke you've had, meaning where in the brain the stroke happened and how severe that damage is from the stroke itself. So, today I want to explain what's actually happening when double vision occurs, why it happens after a stroke, and some practical hands on things you can do to try to make your everyday life just a little bit easier while your brain and vision continue to recover. Okay. So, what exactly is double vision? The medical term is diplopia, but all that really means is seeing two images of a single object instead of one. Sometimes the images are side by side, sometimes they're like layered on top of each other, and sometimes they can actually be like slightly on a diagonal. For some people, they're experiencing, their double vision all the time. For others, it may only happen when they look in a certain direction or when they get really, really tired or overly fatigued. But here's the thing to keep in mind. For most people experiencing double vision, the problem isn't actually with the eyes themselves. The health and the acuity of the eyes, the ability of the eyes to see and to see clearly, may actually be okay. The problem is that the stroke has affected the way your brain communicates with the muscles that move the eyes. Normally, both eyes move together like a perfectly synchronized team. They point in the exact same direction at exactly the same time. Your brain then combines those two images into one clear image. We don't even think about it because our brain, like so many other things it just does this for us automatically. So what we normally think of as vision, by the way of our eyes, isn't exactly accurate. Like true vision and the interpretation of the information our eyes take in, from our environment, all happens in the brain. So now we need our eyes. So we need our eyes to see to take in that information, but our brain is what helps us make sense of what we're seeing. So vision as we know it happens in the brain. But after a stroke, one or more of the eye muscles or the nerves that control them, they may not be working as well as they normally would. So instead of both eyes pointing to the exact same spot, they may be looking in slightly different directions. And when that happens, your brain receives two different images and it can't line them up correctly anymore. And then you see double. Now, depending on where the stroke occurred in your brain, it can affect several different parts of your visual system. It may involve your brainstem, and that's where several of the nerves that control eye movement live, right? Then you have your cranial nerves that tell your eye muscles where to move, or the areas of the brain responsible for coordinating your eye movements, right? That's why I'm always saying every stroke survivor's experience and stroke can be very different, depending on all of these different factors. Again, some people only notice double vision when they look into one side. Some experience it constantly. Some recover from it quickly. And for some, the improvement happens more gradually over time. So, in the meantime, while you're waiting to see how your brain recovers, going through your day to day with double vision can be hugely frustrating because it can affect so many different things you do or are trying to do, right? Things like reading can be difficult because the words seem to overlap on the page. Watching TV can be hard. Judging accurate distances and your depth perception can be off, causing you to bump into things. It can make you feel unsteady when trying to stand or walk. It can cause headaches, eye strain. It can make you feel dizzy, nauseous, or again, just overly tired because your brain is having to work so hard to try to make sense of the two images it's seeing. It can definitely be a lot. So what can you do? The first thing I want you to know is please don't assume that there is this is something you have to live with. There are trained professionals out there who specialize in evaluating these kinds of vision changes after stroke. And depending on your situation, your doctor may recommend you seeing a neuro-ophthalmologist, a neuro-optometrist, regular ophthalmologist, or another vision specialist with experience treating neurological conditions. Okay. There are also some practical things that you can do that may really help. Number one is reducing what we call visual clutter. Your brain is already working overtime, so don't make it work harder. If you're reading, turn off the TV, reduce background noise and distractions. If you have to try and if you really have to try and read something, read in a well lit room. Use a plain bookmark or an index card under each line. If you find you're losing your place while you read, or what they call a line reader, that can be really helpful because it kind of blocks out everything else except the line that you're actually supposed to be reading. Taking frequent, what I call visual breaks, can also be really helpful. Just like your muscles get tired, your eyes and brain, they get tired too. So if you notice your vision becoming worse, later in the day, that may be a sign that your visual system is becoming fatigued. So take breaks. Close your eyes for a few minutes, rest in a quiet room. Sometimes that can be enough to kind of help reset things for a little while at least. Improving your lighting is another important strategy because good lighting really often makes reading at least a lot easier. And be sure to try to reduce glare whenever possible. So if like bright lights are bothering you, consider wearing lightly tinted lenses or even a hat with a big brim when you're outside. But definitely talk with your healthcare or eye care provider about what might be most appropriate for your specific situation. And just remember, depending on the cause of your double vision, your eye specialist or therapist may recommend things like temporary prism lenses that can help align the images, or some may benefit from partially covering one lens of their glasses with special like occlusion tape. But this is different from simply wearing like an eye patch all the time. While patching an eye may temporarily eliminate double vision, long-term patching isn't always appropriate for everyone, and it should only be used if it's recommended by your eye care provider, because the best approach is going to depend on what's actually causing your symptoms, right? So, can double vision improve? Yes. For many stroke survivors, it does improve. Sometimes the brain actually begins to find new pathways and workarounds. Sometimes it improves as swelling goes down. Sometimes, the eye muscle coordination just gradually returns and gets better. And sometimes vision therapy is needed and is an active part of your recovery process. So, again, everyone's recovery is going to be different. So if you're struggling with double vision after your stroke, please give some of these strategies and recommendations a try. I feel while vision changes after stroke are common, they're also not talked about that much. And the important thing is just to make sure that you let your doctors and your therapy team know what you're experiencing so they can help. And there may be treatments, other strategies, and other resources available that you may be able to tap into. Okay. So if you're experiencing any kind of double vision after stroke, leave me a comment. Let me know. I'd be curious to know what it's been like for you, what things seem to have helped you the best. All right. And as always, guys, I really hope this was helpful, and I will see you next time. If you found this video helpful, don't forget to subscribe for more DIY videos to help you along the way in your stroke recovery. Struggling at home? Have a question? Leave me a comment. I'm here to help.